Every child deserves the chance to grow, learn, and thrive. Intestinal worms infections, also known as soil-transmitted Helminthiasis or STH, threaten that chance. In Bangladesh, the STH control program under the Directorate General of Health Services in the Ministry of Health and Family Welfare has spent decades protecting children from these infections, which are among the leading causes of anemia and poor school performance among school-age children. Today, Bangladesh has one of the largest school-based deworming programs in the world, reaching approximately 42 million children every year through a sustained national commitment and operational plan. The Ministry of Health and Family Welfare's work began more than 20 years ago, when Bangladesh conducted its first nationwide school-based surveys to understand the true burden of STH. The results were alarming. Nearly 8 out of 10 children were infected. STH was clearly a major public health concern. The response was swift. In 2008, the STH control program launched biannual school-based deworming each April and October, starting in 3 districts and expanding to all 64 districts by the end of the year. In the years that followed, to strengthen coverage and community engagement, the STH control program introduced the Little Doctors program, a unique child-to-child initiative that empowers students to advocate for health promotion and support prevention efforts, including deworming. By 2017, after nearly a decade of nationwide deworming, it was time to measure progress. Follow-up surveys showed that sustained high-coverage treatment had reduced STH prevalence by more than 80% nationwide, a major public health achievement. In 2022, to further strengthen evidence-based interventions, Bangladesh used geostatistical modeling, combining survey data with demographic, geographic, and environmental information to build a more detailed national picture of STH prevalence. This analysis revealed districts where updated epidemiological evidence was needed to better inform and target deworming efforts. That's when the STH control program mobilized to collect the data needed to guide the next phase of decision making. In August 2025, with technical support from Children Without Worms, the team launched a large-scale survey across 15 districts. More than 3,000 children aged 8 to 12 from over 65 schools participated in the survey. Survey teams measured STH infection prevalence and intensity along with access to safe drinking water, sanitation, and hygiene, critical factors in preventing reinfection. The surveys were conducted from August through November, Bangladesh's rainy season. To reach isolated schools, teams often travel for hours, sometimes by boat, navigating waterlogged terrain, all while carrying microscopes and critical survey supplies. Despite the difficult terrain, the teams pressed on, knowing the information they collected would help improve the health of millions of children across the country. Through months of determined effort, the team ensured no school was left behind. These findings offer more than a snapshot of intestinal worms infections in Bangladesh. They provide a roadmap for sustaining progress and using valuable resources more efficiently. These results will help the STH control program refine deworming strategies, determine appropriate treatment for each area, and identify where investment in safe water and sanitation are most urgently needed. Thanks to the dedicated efforts of the STH control program, Bangladesh is one step closer to ensuring that every child has the chance to grow, learn, and thrive free from the burden of intestinal worms. This is the power of evidence, the power of collaboration. This is how Bangladesh safeguards the health of its children, through evidence-based action, one survey, one treatment, and one community at a time.